Si Joaquin. Hindi, dinalaya ba siya eh. Wala niya, kaya niya lahat. Pero hindi siya dito eh. At ang namin Joaquin, pili ka.
I am always on time. I finished short course in architecture. I have a fascination on buildings, railways, bridges, and roads.
Gumagawa ako ng bikes and motors.
I am BS Computer Science graduate. Nakatrabaho na po ako at nakagawa ako ng chocolate.
Creative ako. Gusto kong nagpe-perform at sumusulat din ako ng kanta.
Nagpe-play ako ng guitar and ukulele.
Nag-volunteer ako at umatin ako ng worship service sa church.
Natutuwa ako kapag nanonood ako ng magagaling umarte sa TV.
My classmates pretended to be friends and they stole money from me.
Binato po ako ng bote ng aking classmate.
Nung high school ako, inasahan nila ako.
Tinatakot ako ng mga kaklase ko. Nahirapan po akong makatulog, makakain, at nabawasan ang konsentrasyon ko.
I am a nice person. I want to be friends with you. Please do not laugh at me because I have autism.
Magpakabait na kaya and God bless.
Mapakabait na kayo.
Magbago na kayo.
People with autism like me are intelligent and caring.
Kaming mga may autism ay may karapatan mamuhay ng may dignidad.
Ang autism ay di pangtawa o pagkasal.
Huwag niyo kami gayahin para lang pagtipan.
We are not caricatures. You can imitate for laughs. My name is Carl.
Ang pangalan ko ay Conan.
Ang pangalan ko ay John.
Ang pangalan ko ay Jolo.
Kapag nakakita kayo ng gumagaya sa isang taong may autism o intellectual disabilities, magsalita kayo. Hindi ito pampagood vibes lang. Yung pagmamaliit niyo po kasi ay ugat ng bullying na nararanasan ng mga taong may kapansanan araw-araw. Ang pagkakaroon ng autism ay hindi joke, hindi din po insulto. Tanggapin, unawain, at bigyan halaga ang mga taong may kapansanan. Let's celebrate our differences and build a kinder and more inclusive world.
Mabuhay to all our local and foreign online participants who are celebrating with us the 26th National Autism Consciousness Week. Hello? Yes, sorry. Okay, so we're expecting a lot of participants from the ASEAN Autism Network and also from the ASEAN Secretariat. So we will be acknowledging them a little later, okay? My name is Danko. My video was shown a little earlier. And I continue to serve as the Chair Emerita of Autism Society Philippines after serving as National President in the many years gone by. And I am also a member of the Executive Committee of the ASEAN Autism Network after serving as its chairman not too many years ago. And both organizations are composed of autism family advocates, including the self-advocates. We can see a lot of them today, just like in our previous events. Okay, so I think there's no need for me to remind you that while the webinar is going on, please mute your mic and also your video. Don't worry, during the group picture taking, we will ask you to turn on your video. So let me start. In November 2018, the efforts of ASP, the Autism Society Philippines, and AAN, the ASEAN Autism Network, in promoting the acceptance, appreciation, and accommodation of persons on the autism spectrum were recognized when I was awarded the inaugural ASEAN Prize. I have always thought it is for us, not just for me. And then, after a month, December 2018, another blessing came. The Association of Southeast Asian Nations, or the ASEAN, launched the 2025 ASEAN Enabling Masterplan on mainstreaming the rights of persons with disabilities. And you will be hearing a lot about the master plan, which is a culmination of collaborative and cross-pillar initiative of ASEAN organizations and entities to enhance the promotion and protection of the rights of PWDs in the ASEAN community. And we will also cover this afternoon the Philippine Autism Policy Framework. So from the ASEAN down to the Philippines and down to the autism sector. Okay, so for our welcome remarks, we have no less than the Deputy Secretary General of ASEAN Sociocultural Community Department. His Excellency supports the Secretary General of ASEAN. He supports the Secretary General of ASEAN in the implementation of the ASCC Blueprint 2025 and leads the ASCC Department of the ASEAN Secretariat. He also oversees the implementation of projects under ASCC that focus on forging a common identity and building a caring and sharing society. His Excellency Ekapab Pantabong.
Representatives of ASEAN sectoral bodies and affiliated entities, representatives of organizations of persons with disabilities, civil society organizations, academies, research institutions, media, the private sector, and think tanks. Excellencies, distinguished delegates, ladies and gentlemen, good morning. I am honored to have the opportunity to address all of you to the opening of this webinar on the ASEAN Enabling Masterplan 2025. I would like to congratulate the Autism Society Philippines for organizing this important webinar. This event marks another milestone in ASEAN as we continue our journey to promote and to protect the rights of the welfare of persons with disabilities in the region. Excellencies, ladies and gentlemen, ASEAN has been at the forefront in building the disability inclusive community. The ASEAN Enabling Masterplan 2025 serves as our robust benchmark to promote and protect the rights of persons with disabilities across sectors and three the ASEAN community pillars. The implementation of the ASEAN Enabling Masterplan manifests the steadfast commitment in ensuring that persons with disabilities are not left behind. It also encourages the purposive engagement of the various stakeholders, especially the organizations of persons with disabilities, private sector, and the civil society organizations in order to realize the objectives of the master plan. Adhering to the vision of an inclusive community in which independence, freedom of choice, and full and effective participation of persons with disabilities are fulfilled. The Enabling Master Plan has clearly articulated the importance of empowering not only persons with disabilities but also their family members, assistants, caregivers, and communities. Excellencies, ladies and gentlemen, reinforcing the implementation of the ASEAN Enabling Master Plan is the joint statement on mitigating the impact of the COVID-19 on the vulnerable groups in ASEAN that was adopted by the ASEAN Ministerial Meeting on Social Welfare and Development, AMSWAT, in 2020. The ministers acknowledged the diverse needs of persons with disabilities for the COVID-19 response and recovery, and to encourage the mainstreaming to disability in all the measures to ensure the disability inclusion. Also, the ASEAN Comprehensive Recovery Framework will guide us with robust, holistic, and practical direction to recover and to become more resilient and sustainable. Our recovery measures will be inclusive and consider different needs of all people in ASEAN. The recovery framework is aimed to also to strengthen the fundamental for future resilience, such as in social protection, human security, and digital connectivity in this region. The Autism Mapping Project in the ASEAN region serves as an important milestone in ASEAN's long-standing commitment to protect and to promote the rights of persons with disabilities in the region. This report highlights the mapping of the situation of persons with autism, organizations supporting the persons with autism, as well as the newest innovations available to persons with autism in ASEAN. Excellencies, ladies and gentlemen, let me conclude by expressing my high hope that this webinar will arrive at effective and concrete disability inclusive policy recommendations and actions to mitigate the impacts of the pandemic on persons with disabilities, particularly the autism. It is through our collective strength and the solidarity that we will realize the people-centered, people-oriented, and inclusive ASEAN community. With these words, I wish you a very successful webinar and fruitful deliberations. Thank you very much.
Okay, so again, would like to thank His Excellency Ekapab Pantabong, the Deputy Secretary General of ASEAN Socio-Cultural Community. I just want to comment on some of the things from his message. He said that the master plan, the enabling master plan, is another document to show ASEAN commitment that PWDs will not be left behind. And he also stressed the importance of empowering PWDs, not just not just those with autism or with disabilities, but also their families and their community. And while the master plan was crafted in 2018, completed in 2018, they have already included the response and recovery for COVID-19 because our PWDs, including our children with autism, are highly vulnerable during this pandemic. And he also cited the Autism Mapping Project, spearheaded by the Asia Pacific Development Center on Disability, which gave a situationer on autism data. Okay, and well, he expects that we can come up with some recommendations for other policies during this event, which we will attempt after the presentations. And now, another message from a local government agency who is our staunch partner in promoting and protecting the rights of PWAs and PWDs in general. Here is the Executive Director of the National Council on Disability Affairs, Mr. Emer Rojas.
Pinagbalang araw sa inyo pong lahat. Allow me to congratulate the Autism Society of the Philippines for spearheading this collaborative and cross-pillar initiative for the ASEAN Enabling Masterplan. Truly, the ASEAN Enabling Masterplan is one of the landmark documents that mainstreams the rights of persons with disabilities in the whole of ASEAN. It is a blueprint that is directed towards the realization of inclusive communities, while at the same time recognizing the role and contribution of persons with disabilities in the whole of the ASEAN sub-region. Moreover, the Enabling Masterplan conforms to the general principles of the UNCRPD, which is common to all member states. Further, the ASEAN Autism Mapping Project supports the realization of this master plan to establish comparable and reliable data of people with autism in the whole of ASEAN. In this time of pandemic, evidence-based data is essential in crafting responsive policies, programs, and projects that empowers persons with disabilities to effectively exercise the rights to access and avail these services. As such, the National Council on Disability Affairs, being the lead agency in the monitoring of the UNCRPD and the focal point for the monitoring on the implementation of this ASEAN Master Plan, fully supports this endeavor that is directed towards the empowerment and promotion of the rights of persons with disabilities, including people with autism, especially in this time of pandemic. We enjoin all of you to work together with pride and unity as ASEAN citizens to realize the vision and the purpose of this document and to make the rights real for all persons with disabilities. Mabuhay ang mga may kapansanan. Mabuhay ang mga Pilipino.
Okay. Yes. Mabuhay po kayo, Ka Emer. So, Sir Emer also, okay, also emphasize that what we're going to discuss now, the master plan, is a landmark document for PWDs in ASEAN, and he also stressed how the importance of evidence-based data for us to craft effective programs for PWDs. Okay, now we're done with the formalities, and I think I can go back to my usual self. when I'm speaking in full English, I become a little formal. Okay, you have attended this week a lot of online events by ASP, like employment, interventions. We were also talking about early response to emergency situations. And we were wondering if a lot of you are already familiar with what we're going to talk about. So I would like to do a little poll to find out, so that our next speaker will know how fast or how slow she should go. Can we show the poll? Tech support, okay? We now have, okay. So, my question, please answer them. Have you heard of or read about the ASEAN Enabling Master Plan 2025? You can only answer either yes or no. And let's see. Wow. All right. Okay. Okay. Miss Ajeng. I can see Miss Ajeng smiling. Yes. Okay. Okay. Well, I'm not surprised. I'm not surprised. Okay, because the the master plan is more on the planning level there upstate. So I think our two speakers today should be able to uh, download this down to the level of our participants. So before we call on our first speaker, we'd like to show this video. Yes, overwhelming. It's a no. Okay, yeah. So no is 76% and yes is 24%. Okay, so Miss Ajeng, so you know that. Okay, can we show this short video about the ASEAN, the Enabling Master Plan? Okay. Miss Ajeng is so cute. I can already see her smiling.
Do you know in ASEAN, over 17 million people struggle with accessing the public facilities every single day? People with issues of sight, mobility, hearing, and intellect still face many barriers in their everyday lives. For persons with disabilities, society still has little solutions for them. Well, that's about to change. The ASEAN Enabling Masterplan 2025 is committed to mainstream the rights of persons with disabilities, ensuring that each individual enjoy their equal rights like the rest of us. With accessible facilities and increased communications, persons with disabilities have more ways to travel out of their homes to discover and connect with their communities. With better systems and new technology, persons with disabilities are empowered to pursue an education, which gives them better prospects in the workforce. And with a stable income, they can take over the steering wheel and have the freedom to make the decisions that matter. So let's change our attitudes and work hand in hand as a people with one vision, one identity, one community to build a better ASEAN. Are you ready to make this change?
Okay, so are you all ready to make this change? So while I give you a brief background about our first speaker, maybe our tech support can already spotlight her so that you can all see how pretty naman our first speaker. Okay? Hello. So, to explain to us, for 70% of us, for the first time, explain to us what is the ASEAN Enabling Master Plan 2025. We have Miss Ajeng Purnama Pratiwi, a Poverty Eradication and Gender Officer at the ASEAN Secretariat. Can we spotlight her now with me? Okay, while I describe while I describe what she does. Okay, her current focus of work is on the promotion and protection of the rights of children, persons with disabilities, elderly, as well as social protection, rural development, and poverty eradication strategies. She also is a contributor of several ASEAN documents, including what she will be discussing right now and the ASEAN Autism Mapping Projects. Miss Ajeng Purnama. Miss Ajeng, can we spotlight Miss Ajeng with me first? Hello. Hello, Miss Ajeng.
Hello, Miss Dang.
Yes, because of the pandemic, I miss attending the ASEAN anniversary celebration in Jakarta, where
Yeah.
I'm always awed by the scope of work you're all doing for the region. And also, I am also, of course, awed by the building itself. Okay? So, so we're all excited to hear for the first time what is the ASEAN Enabling Master Plan. Okay, you can take now, not the floor, you can take now the line.
Thank you very much, Ms. Deng. The pool, the pressure is very high. It's at the same time, it's very excited to share some of the updates about this creature. I think some of you, 75%, 70%, we're wondering what kind of creature we're going to discuss about. Thank you very much again, Ms. Deng, for the kind introduction. I think your vibrant aura is very affecting, and most people will agree on that. And once again, a very good afternoon, colleagues and friends. My name is Ajeng Purnama. You can call me Ajeng. I'm from the ASEAN Secretariat based in Jakarta, and now I'm connecting from the not so sunny Jakarta, but hopefully the weather will be way better in your place. So this afternoon, I would like to joining His Excellency Ekapap, our DSG, in congratulating ASP in organizing this very important event, the 26th Philippines National Autism Consciousness Week, which I understand was conducted between the period of 24 and to 30th of Jan. And once again, also, I would like to extend appreciation and thanks to SP for extending an invitation to ASEC to participate in this event. Today's theme is on the ASEAN Enabling Masterplan, and I think it will be very interesting as we will witness the journey of ASEAN in promoting an inclusive community, and also to see the development, the implementation, as well as the milestone of the ASEAN Enabling Masterplan. May I seek the assistance of ASP team to upload, yes, the presentation, please. Thank you very much. Okay, maybe we can move to the second slide, please. Thank you. So, colleagues and friends, I think persons with disabilities, which comprise a quite big percentage, estimated around 15% of the global population, and many study indicates that they are one of the largest minority groups in the world, and in ASEAN Pacific, I think it is estimated about 690 million persons with disabilities, including those with different disabilities, from physicals, experience low vision like myself, and also cognitive or developmental disabilities, psychosocial disabilities, and those with multiple disabilities. And persons with disabilities also face numerous barriers that sometimes or most of the time restrict their full and effective participation in society on an equal basis. And this is, I think, they are among of the highest risks of being left behind in the development process. This is, I think, our DSG and also Ms. Dang has also highlighted about this. And the risk is particularly pertinent given the rising inequalities across the world, which has also impact disproportionately on persons with disabilities. And in the presentation, in the slide that you were we are looking at, in ASEAN, the disability prevalence varies from one country to another. So it varies from 1.1% in Brunei up to quite high in Vietnam, amounting of 7.8%, and also Indonesia that reach 8.6%. Could you please move to the next slide, please? Thank you very much. So this is a very colorful slide, but this is just to highlight that the ASEAN has put a premium of persons with disabilities issues, and this has been the issues of persons with disabilities has been identified as one of priorities issues in the region. As you may aware, ASEAN consists of 3 community pillars of regional cooperation. So there are 1 pillar, social, political security pillars, and then there's economic pillars, and the socio-cultural pillars. So as indicated in the presentation, specifically under the socio-cultural community cooperation pillar, ASEAN aims to establish a community or a region that is inclusive, sustainable, resilient, dynamic, and one that engage and benefit the people. So in the socio-cultural community cooperation pillars, they also have a blueprint which will guide the region in achieving its vision, its goal by 2025. And the blueprint targets, among other, and I would like to highlight the yellow circle. It says to promote an equal access and opportunity for all, as well as promote and protect human rights. So I think I would like to highlight a particular target of the blueprints on that. In the next slide, you will see that, could we move to the next slide, please? Thank you very much. So in this slide, in order to translate the big vision or the goals from the blueprint, ASEAN agreed to develop and create other documents to reiterate its commitment in promoting an inclusive society and protecting the right of persons with disabilities. And these were two important documents are established. In 2011, the Bali Declaration on the enhancement of role and participation of the person with disabilities in ASEAN community was adopted, and together with this document, there's also another document to support, which is the mobilization framework of the ASEAN Decade of Person with Disabilities, which covered the period of 10 years from 2011 to 2020. This document actually, just to reaffirm again, ASEAN commitments toward an equal rights and opportunities for persons with disabilities in all spheres of ASEAN society. Next slide, please. Now we are going to discuss about this beast, the ASEAN Enabling Masterplan. What is this? What is this creature? So following the two documents, so we have the blueprint, which is translated into the declaration. ASEAN established another document to further translate the declaration. The objective of the ASEAN Enabling Masterplan actually is just to come up with a more practical guidance that will assist ASEAN member state in achieving an inclusive ASEAN community. Adopted in 2011, as shared earlier by Ms. Dang, this is what the ASEAN Enabling Masterplan is about. The overall goals of the Enabling Masterplan is to contribute to the enhancement of the implementation of the CRPD at the regional level, the regional declaration, the Bali Declaration, building an inclusive community where independence, freedom of choice, and full and active participation of persons with disabilities in all areas of life are realized and sustained. And this document also puts a premium on collaboration and cooperation between different sectoral bodies within ASEAN across the three pillars. As you would recall earlier, there are three different pillars in ASEAN, and this document just try to ensure that the participation of the three pillars are there. And not only the pillars, not only the sectoral cooperation, the document also encouraged the participation of civil society organizations, particularly DPOs. And it is also, I think, important to highlight that the development of Enabling Master Plan also promote the inclusivity from the very stage. So from the development of the development process, the document engage DPOs in come up with the document, and it's I can already say that it's a joint effort from the very beginning. In the green dots, you would see that there are different sectoral bodies, different sectoral cooperation that engage in the development of the document together with the DPOs. So there are SOMSWAT. This is the Senior Official Meeting on Social Welfare and Development, consisting of ministries working on social welfare issues. We also have ISHAR. This is the ASEAN Intergovernmental Commission on Human Rights. Most of them are ambassadors and experts who's working on human rights. And the last one is the sectoral bodies the Commission on the Promotion Protection of the Rights of Women and Children. So and they are coming from different pillars. So since the very beginning, the inclusivity has been really embedded in the documents. Can we go to the next slide, please? And this is just a brief explanation about the key feature of the Enabling Master Plan. It highlights that the interests and needs of persons with disability must be taken into considerations. Inclusion and mainstreaming should be promoted. Provision on building the capacity of persons with disability should also be echoed, and the regular policy dialogue events are being promoted. In the next slides, in some of the upcoming slides, we will see how ASEAN translate these features into a series of activities. And these are the key point, as you will recall that the ASEAN Enabling Master Plan continues to promote the inclusivity since on its implementation. So ASEAN Enabling Master Plan really want to make sure that this document is aligned with the blueprint of the three pillars, not only the social cultural pillars, but also with other two pillars of political, security, and economic pillars. And the document also identified the linkages between Enabling Master Plan with their blueprints that each pillar could contribute to in the implementation of ASEAN Enabling Master Plan. This is also a very important example on the effort of ASEAN in ensuring that the promotion and protection of the rights of person with disabilities becomes the priority in the other three pillars and other spheres of cooperation, not only social cultural cooperation. Next slide, please. And this is the one of the objectives of the ASEAN Enabling Master Plan. We truly hope that the ASEAN Enabling Master Plan will serve as a concerted efforts in addressing barrier and inequalities faced by persons with disabilities, because I think the implementation also encourage member states to take into consideration the enabling access to all mainstream system and services, to also invest in specific programs that service for persons with disabilities, strengthening the national disability strategies and action plan, promoting inclusive communities, and then human resources capacities, also ensuring that the funding is available, and public awareness. This is something that also has been highlighted in the document. And I think earlier mentioned about the importance of disability data collection and research. So this is what the ASEAN Enabling Plan is trying to advocate. Next slide, please. So we will deep dive a little bit about the implementation of the ASEAN Enabling Master Plan. So the as I mentioned earlier, the ASEAN Enabling Master Plan really want to make sure that every angle of cooperation in ASEAN is contributing and implementing this to ensure that the promotion and protection of persons with disabilities become their priorities. And I think DSG Ekapap Pantafong in his remark also highlighting the role of AMSWAT. This is the ministerial the cooperation on social welfare and development at the ministerial level, and they are appointed as the focal point to oversee the implementation of the interpillar cooperation of the Enabling Master Plan. And ASEAN Secretariat, my office, will also report the progress of implementation in a joint meeting. So the JCM meeting, the Joint Consultative Meeting, is a meeting attended by the three communities. So it's really this is where all pillars are aware about the development and the implementation of the of this document. And then another thing that ASEAN Enabling Master Plan is wished to highlight is that to make sure that each sectoral bodies they have a standing agenda item in some of the coordination. So I think this is important because one of the observation that we see is that persons with disabilities sometimes are seen as an issue under the social cultural pillar and not under the it's not a responsibility of other pillars, and this is trying to be changed by the document. And I think what is also important is that the effort of this document to ensure the participation and engagement and partnership of different stakeholders, including CSOs and GPOs, and also to promote the CSR for inclusive and sustainable development. Next slide, please. So this is one of the sample of events on how, on the effort of ASEAN to promote the ASEAN Enabling Master Plan. If you remember that one of the features in the document is to build the capacity and also encourage more participation of different stakeholders, and this is one of these events. I think Ms. Dang also mentioned earlier that we try to be adaptive and to be really able to capture the different development. So when there's a COVID-19 pandemic hit us back into 2020, we're thinking about ensuring that the issue of persons with disabilities during pandemic is highlighted. So ASEAN Secretariat, together with ADF and Agenda, we organized ASEAN web series on disability inclusion and COVID-19, ensuring accessibility, equal rights, and opportunity for all. The objective is very simple, to raise awareness on disability inclusive analysis and approaches, as well as in order to identify pathways to mainstream the right and promote the welfare of persons with disabilities pursuant to the implementation of his Enabling Master Plan. We organized 3 different webinars. So the first webinar was held focusing on engaging persons with disabilities for effective response and recovery. This was held on 27 August 2020. And then on the second webinar, we tried to engage economic pillar. So the theme is slightly changed. The ASEAN economic integration. So and we discussed about challenges and opportunities for persons with disabilities in terms of ASEAN economic integration. This was held on 5th of October 2020. And the last webinar is held on 10th of December 2020. And we focus on the disability inclusion, smart cities, and ASEAN connectivity. So these 3 webinars is really touch upon different pillars to ensure that everyone is, be part of the implementation of the project, of the document. Next slide, please. And aside from the implementation, the ASEAN Enabling Master Plan, this document is also completed by the monitoring and evaluation system. And it is agreed that the master plan will develop a monitoring M&E strategic and result framework, and then a midterm evaluation as well as an end of term evaluation will be conducted to assess on whether this document is really helpful in helping member state promoting and engaging the issue of person with disabilities into the work. And it will also consider the implementation of different types of disabilities, including migrant workers with disabilities. So we try to cover as many as possible the changes that we face. And the monetary evaluation also encourages the participation of CEOs. In this matter, we engage with the ASEAN Disability Forum. This is the ASEAN entities that has been also joined ASEAN in developing the document. Next slide, please. I have only a couple of slides, please bear with me. So still on the monitoring evaluation part of Enabling Master Plan. So these are the M&E document of the Enabling Master Plan. The first one is the M&E Strategic and Results Framework. The objective is to check if the sectoral if each sectors in ASEAN cooperation has implemented the Enabling Master Plan. And I think this is it contains numbers of boxes and stuff that need to check, yeah, the assessment. And then another one is the annual progress report, and this is prepared by ASEC. So we have produced 3 progress report every year to highlight on what of the activities that have been conducted in terms of promoting and strengthening the right of person with disabilities and who have done it. Those kind of report is also shared with wider sectors in ASEAN. And maybe we can go to the next slide, please. So now we have the Enabling Master Plan, which promote the engagement or protection of persons with disabilities. We develop the M&E tools to check or to assess if we implement it already, or whether some of the work, some of the points of the enabling person with disabilities has been integrated to the work of ASEAN. Now we just want to make sure if everyone knows how to use the M&E tools. So we have the document, we have the M&E tools. Now we want to make sure if everyone can do the assessment by using the tools. And these events are organized to socialize and build the capacity of different sectors, different sectoral cooperation in ASEAN on how to assess their performance in terms of Enabling Master Plan 2020. As you can also see, the event is held and target different pillars. So the sociocultural pillars, the training, the capacity building was held. A follow-up was held on 24th of June, and then AC pillar on 16th of July, and for the political security pillar on the 13th of August. To ensure that I think we coordinate with ADF and IFES and Agenda to ensure that the materials that we discuss in the follow-up training is specific and really relatable to the concerned pillars. So there's a different models, a different presentation being prepared for this, so that people feel engaged, people feel relatable to see the linkages, because we also link this with their particular work plan. So it's interesting to see. In the next slide, we will see that is also an overview of the M&E system embedded in the document. The monitoring and evaluation of the M&E is carried out in 4 operational steps. The first one is stock taking. This is actually just for sectors to listing down their activities that relates to person with disabilities. The second step is the self-assessment. So each body will be invited to review whether or not the listed activities is really contributed to the implementation of the Enabling Master Plan, and also to check if they touch the person with disabilities as the beneficiaries of the document. I think this is important to analyze, to assess whether or not the initiated projects are really linked and touch the needs of person with disabilities. And the third step is peer learning. So this is similar self-assessment, but it was reviewed by a bigger audience. More stakeholders will be invited to check about the achievement made on the contribution to the Enabling Master Plan. And then the fourth step is the actional quality control. And this is in the form of midterm evaluation, which is scheduled in 2022 this year, and the end of term evaluation scheduled in the end of the document ended period 2025 or 20 or around 2026. So the next slide will be my last slide. It's just a continuation of the previous slide. It highlights the important timeline in implementing the fourth step. So the first step, the stock taking, is expected to be completed by February. We would like to also thank IFAS for helping ASEAN Secretariat in supporting the stock taking process. And the self-assessment, the step 2, is expected to be completed in March. The peer learning is planned to be conducted between March and April, and the midterm review is expected to be done in September 22. So I hope that information will be able to provide some sense and give you updates on what ASEAN Enabling Master Plan is. And please feel free to share maybe later during the Q&A if you have any question on that. Thank you. Thank you, Ms. Dang. Over to you. Ms. Dang, apologies. I think you're still...
Okay, sorry. Okay. Yeah, I asked that we can be together on the screen. I was thinking, how would I recap your talk? Because in in getting to know this creature called the EM 2025, I have to use a lot of big words and the acronyms and all, no? But there's one slide, no, that struck me and which I'd like to maybe sort of check with our participants, the local participants, our chapter leaders, our self-advocates, no? This is the slide 8, the barriers and inequalities. Maybe whenever we start a program, a service, we can ask ourselves, are we enabling access for PWAs, for mainstream systems and services? Later on, somebody will be talking about this. I will not talk about the government part in terms of investing and funding, okay? But maybe, are we promoting enough inclusive communities? Are we improving our human resources, not just the self-advocates, but also the people, the parents, the communities? And are we increasing, this one, we're very good at this. Are we increasing public awareness and understanding? Okay, Sir Elmer also mentioned data collection. We're not yet, okay. And research about disability. So later on, Ms. Ajeng, we will have a Q&A portion where they will see your beauty again. Okay, so thank you. Please don't leave. Okay, and for our next speaker, okay, can I share spotlight with our next speaker? Okay, so hello? Is she with us? Yes. Share kami, share kami. Okay, tabi lang muna kami. Kunwari magkatabi kami. Okay. Okay.
Hi, Dang.
Hello, Mona. Of course, I think for the majority of the participants in the room who have been following us since Monday, the start of the National Autism Consciousness Week, uh, the woman on my left, okay, needs no further introduction, okay? But still, yeah, we all know she is the national president of Autism Society Philippines for her on her fourth consecutive term. She is mighty magulang in social media with millions of followers for history. And this one I picked up yesterday, and I like this. No, one of our panelists yesterday during the employment uh, forum said that Mona is a miracle worker because of the extent of work she has done for placement of persons on the spectrum, for placement to get jobs. No, so I like that. Another M on Mona, miracle worker. So here's Mona Magnovelus to translate the EM 2025 to Philippine and autism sector setting. Okay, go
Thank you
Mona.
very much, Miss Dang. You've been very kind. Parang hindi ko deserve. It's like I don't deserve a lot of the accolade that Miss Dang kind of on there, laid on thick there. But I am the national president of the Autism Society Philippines, and in that role, I have been tasked back in 2018 when the master plan or the enabling master plan was still being rolled out. There was already a parallel effort within the ASEAN Autism Network and ASEAN to come up with an mapping project. And the mapping project is it's not to count the number of persons with autism in the country, but it is about looking at the environment and assessing what we need to move forward. So when we were doing that, and remember, we were doing this in the context of being a CSO. We are a civil society organization. We are not part of government. We have to work with government, and we have to understand how the hierarchy works so that we can connect all of the global goals and global policies and down to the grassroots. So in trying to understand that mechanism, we came up with the Philippine Autism Policy Framework. And I'd like to highlight that this is for the Philippines and for autism. In the room today, we have a lot of individuals from other countries, as well as those from PWD federations and PDAO organizations. So please bear in mind the context of my presentation. So this slide shows us how it is important to look at global goals, regional goals, local goals. Remember, in the Philippines, we have the Philippine Development Plan 2017-2022. This was laid out by President Duterte when he first came into office. And we also have a very comprehensive Magna Carta of Persons with Disabilities, which not all countries in ASEAN have. So in some ways, we are, I guess, lucky because we have that. And we wanted to also adapt certain principles that were consistent across these global and regional policies. It has to be rights-based, it has to be inclusive, it has to be relevant, it has to be complementary, and there has to be a connection. It should allow for connection across the different sectors. Our stakeholders here in the Philippines, we've identified them. Aside from government, we also have business, media, academia, and the general public. We should not forget that this is a genuinely public and private partnership. Now, in our consultations in the Philippines, we came up with three major pillars, and that is protection, participation, and development. And I'd like to go into detail on those today. So when it comes to protection, there were three major areas, and there were several groups that we called out to be able to provide. This is, and let me go back, outcome. and the stakeholders who are responsible for delivering those outcomes. So we are trying to connect the grassroots outcomes with our goals as a region and as as humanity. So back to protection. I'm going to go through each area and kind of say where we are using the traffic light system: red, yellow, green. Okay. So in terms of equitable coverage for medical and therapy expenses, I would say yellow, primarily because the government has already put together budgets for universal healthcare, funding supposedly for PhilHealth, ZMorph. And I think what is greatly lacking now are the policies and protocols so that we can find the healthcare that we need. And I'm talking specifically for you parents out there who are asking, when can we get free therapy? When can we get free consultations with developmental pediatricians? All of these policies are in place, but the implementation is what we are struggling with today. If you layer the COVID, the COVID situation on that, it becomes a little bit more complicated. The next area is disaster preparedness. We also labeled it as yellow. And I think aside from the efforts of NCDA to go and talk to our government when it comes to disability inclusive disaster risk reduction and emergency preparedness, the private sector is also on board. So we have SM Cares, who is a main stakeholder in this, and we have been attendees to the massive conferences that they've hosted. The last on this pillar is reasonable legal accommodation. This is still a red for us because our legal system today is not able to provide the right kind of support if ever a person on the autism spectrum comes in to the legal system, either as a victim, a witness, or the accused. So there is still a lot of policies and protocols that we need to improve in that area. The next pillar is participation. How can we get persons on the autism spectrum involved in our daily lives, right? First is we need to get all agencies trained in sensitivity, in disability sensitivity, not just for autism, but for all disabilities. There is a mandatory disability sensitivity training for government agencies, but we also have to expand that to include schools. Like the disability sensitivity should start while they are in school. Next area is data. We do not have the data. We do not have the disability database that was supposed to be in place as per a law 10 years ago. We still do not have that. The Department of Health sponsored a study on autism prevalence in one island, in Panay Island, on 2017, but the study failed due to procedural lapses. Next area, of course, is the barrier-free access to transportation. There are some challenges in this area with and we have been in contact with the Department of Tourism and the Department of Transportation. But especially in the COVID context, there are still challenges around this. And of course, inclusive employment. There is a law already in the Philippines expanding the number of positions reserved for persons with disabilities. In the US, they went back another level by saying of those that are of the area that is reserved for persons with disabilities, a certain percentage has to be marked for developmental disabilities. So there is still a way to expand that, primarily because the disability in the Philippines is still defined as physical disabilities. There is still very poor appreciation for the kind of accommodation that somebody who is neurodiverse may need. And by neurodiverse, I mean somebody with autism, ADHD, somebody who may be dyslexic. So these individuals are able to are very intelligent, and they can be an asset to any organization, but they would need employers who would know how to give them the right tools. And the last pillar is development. And this is really where we look at the lifetime of individuals on the autism spectrum and how we can care for them, not just from a legal standpoint or all of that, but their total development, right? So early detection and intervention is one of the things that we have said would make somebody successful. If this happens, we have to institutionalize community-based rehabilitation. Right now, a lot of geographies are still not covered by professionals. There's no therapy there. There are a lot of pseudo-professionals who may not be properly trained. So we have to invest in community-based rehabilitation so the community themselves can find the right resources. We have 13,000 members, and we have 100 chapters all over the country. And to a large extent, our chapters and our leaders have been moving that agenda forward. Education and training support. Laws on inclusive education exist. Again, like all of our, we need a bit more. We need a little bit more attention on implementation. National testing support, which is in depth ed, CHED, the Civil Service Commission, and the Professional Regulatory Commission. We've been having, so one of the, if you remember just a couple of, one slide back, we were talking about employment. We cannot push for employment in government if individuals on the auto exam. So they would have to be able to provide some accommodations. So there would be more civil service eligible persons on the autism spectrum. And this is a conversation that we are continuously having with our friends from CSC, PRC, CHED, and DepEd. That's why it's a yellow. Last but not the least, accessible adult intervention and residential care. So one of the things that people sometimes have a misconception about is autism is a childhood condition. It is not. As adults, sometimes their autism can manifest in certain ways that make people confused or make them confuse autism with other mental health conditions, which is why the adult mental health support is very important. And one of the gaps that we see, you can see the red button right there, the policies and budgets for improved residential care for older people on the autism spectrum is not yet there. And that is a green field that we have to explore. Now, it is important for me to, again, put our model in the context of the global scenario. You know, this is a rights-based approach. It is not medical. It is not charity. But we still have to make everything relevant. For your information, our Philippine Policy Framework was executed in consultation with the ASP community. We had a series of consultations in Cebu, in Manila. So we are part of this conversation. We continue to drive the conversation, and we have been very happy with the participation of our chapters as well as our self-advocates. So in closing, what I would like to say is sometimes when we talk about the ASEAN Enabling Masterplan and policy models like this, a lot of us on the ground, a lot of us on the grassroots sometimes feel this is too much. I don't care about this. But I would like to stress that these are important conversations, because if we do not have a goal, we are going to be, we are going all over the place. We have to be able to understand the global, regional, and local policy setting mechanisms so that we know that our activities on the ground are being addressed and our activities on the ground are being appreciated. We also now have a unique, I guess, opportunity to be part of the conversation. If we drive the conversation around rights of persons on the autism spectrum and persons with disabilities, then we are heard at the national level and at the regional level. And that, my friends, is really what all of this is about. No one group has the answer to everything. All of these plans, policies, and activities on the ground have to connect. With that, I'd like to thank everyone for listening to me babble. Ms. Dang, thank you so much.
Yes, thank you, Miss Mona. You know, while we were talking, I remember that time when we had our strat planning for ASP, where we were assessing, okay, we've done so much here. Which pillar is this? We've done so much here. For which part is this? So that we can see the big picture, that maybe we don't just use the shotgun, you know, or we just
Correct.
excited with one's little event that does not really contribute to
Correct.
the overall program, no? So again, we appreciate you are such a
You're
blessing
right,
to
Miss Dang.
us.
That's a very important thing. And I'd like to highlight that, Miss Dang, if you allow me.
Sure, sure.
When we do any activity on the ground, it has to connect to an outcome that is in our plan. We don't just do everything left and right because it feels good. It has to connect to the plan. And that is the way that we are going to be effective.
Yes. And again, I'd like to express this that Autism Society Philippines has been blessed with your presence, with this all strategic. Okay, so before we go to our Q&A, we actually ask a self-advocate, no? To review what you presented and what Miss Ajeng presented, no? And because in the past events, we've already invited Filipino self-advocates. So this time, we invited Miss Nunu Supaanong, who is an autism advocate from Thailand. She is actually working for the APCD, or Asia Pacific Development Center on Disability. And in 2019, she, together with her newly known peers with autism, founded the ASEAN Autism Self-Advocacy Network, a sharing and advocacy platform for persons with autism in ASEAN region. So as they say, nothing about us without us. Let's hear it from Miss Nunu.
Hello everyone, this is Nunu Supanong from Asia Pacific Development Center on Disability here, and thank you for opportunity to invite me to be part of Open Forum. Sadly, I cannot join today, but I will share with you my special video on my thoughts and opinion on ASEAN Enabling Masterplan. First of all, I would like to appreciate multi-sectoral collaboration on development of this master plan. Speaking of which, the 2025 is coming closer, and I would like to see this master plan, from my opinion, becoming more tangible as follows. One, the contact information of agency in each stakeholders, such as disability, some sort, or city official meeting on social welfare and development, government sectors, and etc. Second, health insurance, because in many countries, including Thailand, persons with disabilities still cannot apply for health insurance. Next is about public relations on master plan and accessible format. Should have easy to read version in ASEAN member state national languages, including EPUB file and accessible text. Next is about the financial literacy and transaction. Person with autism cannot open the passbook by their own, and or even with their guardians or parent signature or presence, which will lead to sustainable employment, as most of companies ask the employee to have their own passbook with their own name. And next one is a leadership in autism employment. From my observation, ASP have very good practices on employment with many business sectors, such as Pancake House and SM, but to be beyond. Persons with autism should be able to succeed in their own employment and career life, like me, because not every person with autism will be lucky like me or have some opportunity to prove themselves that they can do better than just daily workers. They can do cashier, they can do stock checking, or whatever they like to be, as long as they want to do. And next one is I would like to share is coping with COVID-19. Actually, it's the last one, because COVID-19 will not go away easily, and we have to live with them. In this relation, there are many ways to do during pandemic. Before and after this master plan, first thing to do is collect and publicize good practice in community, national, and regional level. You can figure out it's like a south to south cooperation, like from the bottom up and top down cooperation. And another thing is capacity building of organization or person with disability and self-help group should be implemented more, because since COVID-19, the training didn't conducted much. And third, should a person with autism in disability inclusive disaster risk reduction preparation process more than ever, as when the disaster come, person with autism suffer the most. And the next one is disability inclusive business. Person with autism have potential and very strong network of parents to implement disability inclusive business. And lastly, to review master plan to be in line with actual situation as much as possible. Lastly, I wish you have a very, very successful and fruitful session today, and hope to see you again someday, whether online or best way in person, especially in Philippines, will be the best. Thank you very much. Maraming salamat po. ขอบคุณค่ะ
Maraming salamat, Miss Nunu. Miss Nunu was really excited to join us today, but something urgent came up, and as you can see from what she said, I'm sure for a lot of our attendees today, they sounded familiar. You cannot have yourself insured. You cannot open your bank account, but some of our adults on the spectrum already have their own bank accounts without the approval of the parents. What else did she mention? No, Nunu actually represents the ASEAN Autism Network when self-advocates are called for during international conferences. So again, Nunu, thank you. She was also part of our Angels Walk several times because she can sing. Okay, so at this point, I'd like to call in again Miss Ajeng, Miss Mona, and I'd also like to call on another guest, the chairman of the ASEAN Autism Network and also the chairman of the National Autism Society of Malaysia, Mr. Kason Ong. Hi, Mr. Kason.
Hi,
Yes,
everybody.
join us when we answer the question. So we are now going to read questions from the audience. Okay? Do we have questions? Because I'm quite sure, especially after Mona presented the Philippines status, the Philippine update in relation to the ASEAN EM plan, no? Maybe while waiting for questions, we can ask Jason for his initial reaction to the presentations.
Okay, thank you, Madam Deng. Can you hear me?
Yes, yes, yes.
Okay, yeah, thank you again for having me on this forum. I agree with Ms. Mona 100% that a lot of grassroots needs to be done before we can go anywhere further, right? For Malaysia's standpoint, we actually have achieved a lot on awareness and also some sort of implementation from the government side, especially the OKU. We call those people with disabilities OKU in Malaysia. So besides autism, the government actually has a plan that states 1% of government sectors must be people with disabilities employment. That is on the government sector side, 1%. They must achieve this. And I think, if I'm not mistaken, they have achieved it not 100%, but probably 60% with people with disabilities working with the government sector. But as for the private sector, still a little bit far off. All right, if we are talking about employment. But we are seeing more corporate companies, big companies taking in, especially not people with disabilities, but more of the autism spectrum. All right, and I'm very happy to share this because the feedback that I've seen and heard from these companies saying that they would actually want more of these autism adults to join because they are very good and productive workforce. You know, they don't need a lot of, they're quite independent, they don't need a lot of supervision, and they do the job fantastically. So this is one point that I would like to share. I think if you're talking about employment, people with autism will do great. All right, you just have to give them a chance for society to accept them, and well, you know, they are all very talented in their own fields. So if the government or even us, if we can highlight their talents, they can go very far.
Okay.
Right? Yeah.
Yes, and I heard Miss Ajeng mentioning a staff of the ASEAN Autism Network Secretariat
Yes.
contributing to the documentation of the ASEAN mapping, right?
Yes. Sure. Yeah.
Okay. So anyway, we have our question here, no? Okay. First question, very interesting, Miss Ajeng. Where is the budget for the implementation of the ASEAN Enabling Masterplan going to come from? Okay. Yes.
Can I respond, Ms. Dang, or should I wait for other question to be pulled before I respond?
I think you can answer this question. This is a very interesting question.
Yes,
Okay.
very difficult one. I think. I think
Okay.
one of the things that enabling master plan is encouraged is that the participation of member state in ensuring that the activities on personal disabilities and the implementation of enabling master plan is integrated in their planning of each member. So it's not coming from the ASEAN Secretariat, unfortunately, although we really want to be able to do that. Unfortunately, the document really encourage member state to have it embedded in their planning, in the national planning. So this is also with the hope that it will be integrated and it would be very easy for member state to show the evidence if in terms of the assessment whether they're already implemented or not. So the enabling master plan really encourage member state to really include the specific budget on the implementation into their planning.
Thank you, Miss Ajeng. This one I think will be for Miss Ajeng and Miss Mona. We are far behind in terms of government involvement for the person on the spectrum sector. what can we do to be heard? What do we do? What can we do better? But I'd also like to encourage the audience to answer that question. Okay, so we'll hear from Miss Mona and then Miss Ajeng, and if Chairman Quezon would like to butt in, please feel free. Okay.
So a lot of disability groups, not just groups for autism, feel the same way. So we are not alone. There is always a gap that government programs and government activities have. And that is why we exist, because we are here
Okay, I think Miss Mona.
fill the
Miss Mona,
gaps. We are here to make sure that we are heard. In the Philippines,
maybe
can you hear me now?
Okay.
All right. So, like I was saying, the autism community in the Philippines is better off than many of the other groups here in the Philippines, because we understand how we are going to be heard and the way that we are organized. And this is now up to us leaders. The lady who asked is Ms. Badette Tabares, who is also one of our leaders in the Antipolo community. And the only way is for you to be visible at the LGU level. For us in national, it is important that we coordinate with the National Council on Disability Affairs and with the agencies, the line agencies, so that we would have a presence. It is at this point where we can influence what the agency does. And this is because we can't jump up to ASEAN and say, hey, ASEAN, can you do this for us? Because in the first place, ASEAN is not that kind of organization. So what we cannot, I guess my perspective is, we can't expect somebody else to do it for us. I have always been a believer in, you have to make the change you want to see. So if you have very specific needs, then do it. Find a way to do it within your community. If you need more help, then we try to find a way to do it. But we cannot fault government for not being there to address it. You know what I mean? It has to be, we have to take responsibility for it and inspire government, inspire other groups to help us. And this connection to the ASEAN has been very profound, I think. When parent organizations come together as an ASEAN community, then we create an even bigger voice, and it is amplified all the way to the ASEAN headquarters in Singapore. In Indonesia.
Right.
It is because of the efforts of parent advocates like Quezon and Dang that we are now a recognized entity at the ASEAN level. And that's a very big accomplishment. It's one step closer to being heard, I think, Ms. Vadette.
And you know, Ms. Mona, if we're near Jakarta, the ASEAN headquarters, and there's no pandemic, they're going to even allow us to use the rooms for meetings and other events. Yes, that's another advantage of being an AAN member and accredited by the ASEAN. Okay,
Correct.
AAN is accredited by the ASEAN. Okay, okay, so you want to give an advice from our Malaysian neighbor?
Yes. Yeah, I mean, our voices will always be there. All right, governments, they come and go. Okay, that is my point. But for us as parents, we will always be there on the ground, giving our support, telling our stories to the governments concerned. So ASEAN actually can play a very big role. If all our governments can just come together like us, and implement whatever plan that we want to put through, even for people with disabilities or even for just autism, because like I said, this particular group of people are and be able to contribute to society. They are not just some group of people who are just not doing anything. All right. So if you have talked about labor shortage in your own respective countries, I think that is a lie. Okay, there's a lot of workforce there, especially with people with disabilities that can work. The blind can work, the deaf can work, you know, people with autism can work. So use them. I mean, this is one way that we can actually work together to make this a reality in the workforce, in the human resources. All right. So yeah.
Thank you, Chairman Quezon. Before we go to Ms. Ajeng, let me just read Mami Badette's reply that she hopes all chapters can do their part on their level so that they can be heard and get louder, and that the autism groups can get together and unite. Okay, Ms. Ajeng?
Ms. Dang, if I may to add, responding to the question, I think it's very heartwarming to hear all the explanations shared by our distinguished speakers on how promoting the rights of autism people. And I think if I may to share an information, I think one of the ASEAN has some platforms that really encourage the participation of persons with disabilities, including the autism people. As you mentioned, Ms. Dang, earlier on the accreditation of the ASEAN Autism Network, this is one important milestone at the regional level that really put forward the efforts of person with autism to be there, to be heard, to really contribute to the development, to be part of the development itself. So if I also may to add some of the information or comments shared by Nunu. She's a very dear friend of mine. APCD, together with the ASEAN Secretariat, is conducting this Autism Mapping Project. And it's always interesting to work with APCD people because they're very, they know what they're doing. So it's very interesting to work with the team. One of the comments or observations shared by Nunu is about the employment, I think, and also about the financial security faced by a person with autism. And I would like to also update that there's also another platform established at the regional level. It called the Network of Experts on Inclusive Entrepreneurship for ASEAN. And this platform is initiated by SOMSWAT, the Senior Official Meeting on Social Welfare and Development. This is consisting of ministries working on social welfare who also play an important part in the implementation of Enabling Masterplan. And this platform, this network is really to gather the person with disabilities to open an opportunity for person with disabilities in terms of economic empowerment. So it's really promote the entrepreneurship of person with disabilities in ASEAN. I think that's one of the a platform available at the regional level that maybe we can use. I know the challenge are there. It's a long journey, but I think we should also appreciate and celebrate that the small steps that ASEAN has made in promoting and also strengthening the rights of persons with disability in the region. In terms of coping mechanism of COVID-19, I couldn't agree more. One of the concern I think raised by Nunu is on the capacity building and the challenges faced by the COVID-19 pandemic when it comes to training. Sometimes I think this is also one of the things that we try to avoid, although Zoom could really accommodate greater participation, but at the same time, we also have to ensure that there will no Zoom fatigue. People are too tired to participate, so really need to check the length of the training and stuff like that. We are, I think, many things need to consider. We are very eager to do this, and also will be also with the CSOs and government in promoting these efforts, participating in the events. I think that's for now, Ms. Tang. Thank you very much.
Yeah, Mona and I were also discussing about the the fatigue, the Zoom fatigue, no?
Yeah.
And before well, there are no more questions, no? So before we call on our guest, there, I saw one, okay, before we go. So data collection, showing statistics is one way to show the government how important it is to help our sector. How can we solve the lack of data prevalence in the Philippines when until now, even the classification in the disabilities had not yet been cleared, especially for autism? Okay, how does other countries effectively do the survey on disabilities? Well, it seems Miss Mona is very excited to answer it. Okay, Miss Mona first before I call on the other panelists.
First off, I share your frustration about this. Prevalence studies should not be a big deal, but it is complicated by I think compounding issues from different disability sectors. So the needs of persons with autism are very different from, say, the needs of persons with mental health issues, or their needs to be identified. So the government really has a challenge in getting their act together. I'm talking about the Philippines. We have been in communication with NCDA, with the DOH, and they really need help. So again, with my earlier advice about taking things into your own hands, one of the things that Autism Society Philippines has been doing is we have been coordinating with research groups. And research groups like the Ateneo have budgets to execute this type of study. That is what we are looking at. We cannot wait for the government to finally prioritize our sector. We really have to take action, and sometimes in the actions that we take, we are in the process inspiring our government into action.
Well said, Mona. Miss Ajeng? Yes, Miss Ajeng.
Thank you. I think I would provide a response from the more regional perspective. I think data collection is one of the challenges that we also face at the regional level. Currently, ASEAN has not yet developed any disability database available at the regional level. So what we can do now is we work or use the information shared by the National Statistic Office, spread in all 10 ASEAN members, and try to collect all the information available on disability. Sometimes the indicator is not the same. I think this is also another notes that we, us at the ASEAN Secretariat needs to think about, is to ensure that the indicator used in the data is the same, so that it's easier. Because do you think it's a bit funny to when you try to promote something at the regional level, but the data availability become a challenge? It's something that is, well, how can you promote something if you don't have adequate data on that? So from again the senior official meeting of social welfare and development, who are overseeing the issue of persons with disabilities, they are working, they meet regularly every year, and one of the discussion is also to develop that. We are at the initial level suggest the collaboration between relevant sector in ASEAN, particularly in collecting disability data at the regional level. We truly hope that as SOMSWAT will be able to really push this initiative, because would be very important. It will be a huge step, because it will engage different sectoral bodies from health, labor, economic. It's a big how do you call it, initiative, but we really hope that we'll be able to support SOMSWAT and member state in pursuing this. Thank you so much.
Thank you, Ms. Ajem. I'm sure both ASP and NASOM and the other AM members would take note of that. Here's a question from one of those belonging to the 70% who is hearing this EM. Now we're using acronym, the EM. She said that I think the EM is an incredible program and would like to know more about it. Will there be a follow-up webinar session about this? Okay, so yes, I'm sure Ms. Mona.
Yes,
Ms.
I
Yang,
really
yes.
hope. Well, currently the initial target is for the government. So the government level, at least because we are coordinating with the government on the implementation of this enabling master plan. So our main target is the government officials who will incorporate or implement this document at their respective country. So, but of course, we have bigger dreams. We are still coordinating with, we're also working with UN agencies like UNESCA to gather support to extend this dissemination or socialization of enabling master plan to a wider audience. So it's not only government, but also to wider audience. We truly hope that 2020 will be one of important milestone for the implementation of the enabling master plan by engaging more partners in the process.
We look forward to that. As Nunu said, 2025 is just around the corner.
Around the corner, true, correct.
Yes, we have two who gave their suggestions that ASP chapters can be members of the Regional Council of Disability Affairs so that we can be involved. I think some of our chapters are like ASP Cebu, and that there's another one here that why not ASP present to the League of Municipalities and the Congressional Committee on Disabilities regarding autism. Thank you po. Okay, we've done that before.
And actually, Ms. Dang, it was asked by one of our chapter leaders as well. And I guess I'd like to just clarify that, in fact, we're always everywhere. We've made presentations to the Committee on Health of the Senate, of the Congress. We have been asked in so many, even within this pandemic alone, we have sat in so many consultation meetings. We've presented to so many groups. So the passion for the advocacy is not there. And I mean, is there, sorry. But sometimes the drive to execute is not there on the parts of the people we talk about, especially when there are other priorities, like, for example, elections.
Yes, our election is coming this May, Ms. Ajeng and Sir Quezon.
Yeah.
Okay, so again, we will maybe put aside a little
Okay.
election. Okay, so are there any more question? No more question? Okay, because if there are no more question, then I would ask Mr. Quezon why he's invited here to synthesize the entire webinar.
Okay. All right. Now, basically, I think the Master Enabling Plan now should be, how should I say, adopted by everyone. Now, firstly, not people with disabilities as well, but with autism, right? Now, these on, let's say, I'm just giving an example from Malaysian side, okay? Autism now is a stand-alone disability. You know, we used to share the same category as dyslexia, Down syndrome, and a few more. Okay, they are called slow learners, learning disabilities. So we have succeeded in actually pulling autism out, and now it's standalone. And we, together with a local university, are trying to establish a database for autism. Right, that is something that I'm very happy to share with everyone here. That hopefully that we are starting something that probably all the ASEAN countries can share as well. You know, how we go about doing the data for autism. You know, I'm sure that all the other disabilities have their own database. It's just that, like what Ms. Ajeng was saying, that we need to coordinate and come up with a bigger plan. You know, that's why it's called the Enabling Masterplan, right? All regions and countries must share this particular information so that we can establish a common goal on how to address these issues effectively and productively. Like I said, people with disabilities are people who can work. All right, they are our future workforce. All right, give them a chance, and they will succeed in helping all our individual countries overcome shortage of labor. All right. So besides that, the enabling master plan as well will coordinate all resources available. Like the question came from the floor just now regarding finance. Who will be financing this project? Well, I think every country will be able to support this, right? We have NGOs, we have non-government organizations in every country that will support the government if they come out, asking for assistance, right? So funding, as I say, should not be a problem. It's more of coordinating all the relevant countries, member countries, to come together and help each other, right? I tell you, ASEAN is a very unique group because we have diverse races, diverse religions, cultures, all various, and we can sit down and work together. I think that is something unique and nobody can actually copy. So if we can put this act together by 2025, I really very sure that we can achieve that probably earlier if we can put our hearts together, all right, for this master plan. 2025 is it's 3 years time. Well, if we can start working now, we will achieve it earlier, much earlier. Okay, so thank you again for having me. ASP has done a good job, and they have always been very active, and I salute them. Thank you.
Thank you, Chairman Quezon. And again, I'd like to add to what you said. ASEAN countries may be diverse, but there's one common factor. You know what is it? The rice, kanin.
Rice. Okay, yes.
No, it's our logo in ASEAN, right, Miss Ajeng?
Yes,
okay.
yes.
One vision, one identity, one community. Okay. Mga bigas po ang ating symbol ng ASEAN Autism Network kasi lahat ng mga member countries kumakain ng ng kanin. Okay? So, and would like to thank all those who attended today. The previous events, we knew there would be a lot of people because those are popular topics, employment, but the enabling master plan for all of you who are here, who attended, who listened, congratulations. I'm sure we have really the right partners in you, right, Mona?
Yeah.
I'm kidding for those who are not in this room. Okay.
Food for them to take it home.
Okay. So let's have our group photo.
Okay, first group. We have 3 groups right now. Okay, 3, 2, 1, smile. 3, 2, 1, smile. Okay, another group. Please open your camera. Okay, in 3, 2, 1, smile. Okay, the last group. Please open your camera. Okay, in 3, 2, 1, smile. Thank you very much.
Thank you. Thank
You're
you.
welcome, Sir Sinin.
Thank you. Thank
Thank you
you.
po. Thank you po.
Welcome. Thank you, Ma'am
Thank you
Dang.
po.
Bye-bye.
Thank you,
Yes.
everyone. Thank you.
Yes. Thank you. Thank
Thank
you.
you,
Tomorrow.
Ma'am Dang.
Tomorrow. Autism OK
Hello po.
Pilipinas.
God bless.
Thank you.
Yes.
Thank you so much.